Hello everyone, the topic of my presentation today is randomized trial of a hypnosis intervention for treatment of hot flashes among breast cancer survivors. This article was published in Journal of Clinical Oncology. At first, we should know the hot flash and hypnosis. Menopause women and the breast cancer survivor, especially 78% chemotherapy and 72% tamoxifen recipients, will suffer the hot flashes. It's related to estrogen depletion, ovarian ablation, tamoxifen, and aromatase inhibitors. The hot flash will influence daily activities, mood, and sleep. There are some treatments for hot flashes, like estrogen or non-hormone agents, but they all have some adverse effects. For example, the estrogen will increase the risk of breast cancer. So the researcher tried to find effective new interventions with minimal adverse effect. From early small studies, it's generally believed that hypnosis is a mind-body therapy that has few negative effects and of significant benefit in reducing the frequency and the severity of hot flashes in breast cancer survivors. The study was developed to know the efficacy of hypnosis in a randomized prospective study. Eligible patients were at least 18 years old and had a history of primary breast cancer and 14 hot flashes per week for 4 weeks. They can take anti-hormone agent for breast cancer, but they cannot use chemotherapy, hormone drugs, mind-body therapy, or CAN for hot flashes. The participants were equally and randomly assigned to hypnosis or no treatment group. Before treatment, they should write informed consent, daily hot flash diary, and do the baseline measurement. The treatment will last 5 weeks. After the treatment, they repeat the measures. The hypnosis intervention was 5 weekly sessions, each to last 15 minutes. The suggestions include mental imagery, deepened hypnosis, dissociation from hot flashes, positive suggestions, and self-hypnosis. They also ask to do the self-hypnosis practice and the in-home practice. So let's see the result. At first, they screened 86 patients, but some people quit or lost to follow-up or withdraw. So at the end, there were 51 patients in this study, 26 in the hypnosis and 25 in the no treatment group. You can see the hypnosis group, the blue line, has better outcome. The hot flash scores decreased 68% from baseline to endpoint. From another analysis, the measurement of hot flash, sleep, and mood all have a significant improvement, and the effective size is large. From the study, they believe that hypnosis is a well-tolerated intervention because of the large effective size and the reduction in hot flash scores. And none of the patients complained or dropped out because of negative adverse effect. The question is, no physiologic monitoring of hot flashes. Let's explain that self-report diaries has long been established as a valid approach to obtain data on subjective phenomena. Another question is the placebo effect. They claimed that There's no placebo effect in this study. Because of the half-life score reductions is greater than 50%, and the control was a no treatment condition. Half-life remained stable. The limitation of the hypnosis intervention is certification in the professional use of hypnosis. The other is that patients may not be good candidates for hypnosis. The study shows the feasibility and the potential effectiveness of hypnosis. So the future study will be the long-term randomized placebo-controlled trial. Thank you for your listening. That's all my report.